Shoulder pain one vandave, shirt put the custom, blouse you cannot put, you cannot comb your hair, you cannot put the hooks at the back. Many issues happen and you need to get somebody else's help here have contracted so extremely that you are not able to take it beyond the range and the impingement of the joint takes place. Now in the impingement relieve pannano, limitation increase pannano. Hello everyone, today's topic is going to be about shoulder pain. Know this, your shoulders, elbows and hands is equal to your lungs and your heart. Your thighs, knees, right up to the toes is equal to your stomach and majorly your kidneys. The back, that is L4, L5, is connected to your large intestines, and that is the reason why sometimes people who have constipation issues, any bowel kind of issues, and daily motion poidu vanama kaalila ana traveling time la sella time edavadhu miss aiduchena, you will not be able to go. Appo you will have discomfort in the back. So always large intestine is and mostly related to your back problem. Nama ellarkume theriyum that heart is related to your left hand, and so this we know because it is heart and it is a major organ of the body. And this is not the case only for the arm. For each and every muscle and joint of your body, there is connection with either one organ, and that has to be determined in the first place. And that is the reason why today's procedure and exercises that I'm going to teach you is going to be involved with the heart and the lung, which is concerned with your shoulders. Okay, and heart and lung is always hand in hand. Oxygen is going inside your lung, and then from the lung it is going to the heart, and apparama it's getting distributed throughout the body. So both has to work hand in hand. Shoulder pain one vandave, shirt put the custom, blouse you cannot put, you cannot comb your hair, you cannot put the hooks at the back. Many issues happen and you need to get somebody else's help to even put some clothes for our own selves. So why is this limitation of movement happening? 180 degrees varaikum poga vendiya unga kai. Why is it getting limited only certain range? Anybody coming with shoulder problem, they will say ivlo dhaan kai pogudhu illana ivlo dhaan kai pogudhu, adukapparama they will only move their body, they won't be able to idhukku mela kai po maatengudhu. So this is known as limitation of your range of motion. The range of motion for your shoulder is always 180 degrees up and 180 degrees this way and 180 degrees this way also. But when that limitation happens, it means that the muscles here have contracted so extremely that you are not able to take it beyond the range and the impingement of the joint takes place. Now in the impingement relieve pannano, limitation increase pannano. Simple. Okay, so how do we do this? Is just by taking those hands to that limit. If a physiotherapist nama enna panuvaana, manipulation engra perla we will take the hand of the patient and move it to that extent. It will be a little bit of a painful procedure, but if you overcome it, then the next day or the following day you will easily be able to do it. Adha neengale kuda pannikalam. Since you are watching this, எப்பவுமே ஃபிசியோதெரபிஸ்ட் ஆர்த்தோபெடிக் கிட்ட எப்போ போவீங்கன்னா பெயின் ரொம்ப சிவியராக இருக்கும்போது, ஸோ உங்களுக்கு ஸ்லைட்டாக ஷோல்டர் பெயின் இருக்குது, கொஞ்சம் ப்ராப்ளம்ஸ் இருக்குன்னு தெரியும் போது, this is the best procedure you can follow. Why you get pain is because of the counteractive action of the other hand. இப்போ நிறைய பேர் எஸ்பெஷலி குக்கிங், லேடிஸ் in the kitchen they keep cooking, people work writing a lot, doing laptops and everything. Sometimes when you use only your right hand, counteractive action is always taking place in the left hand also. For example, when we move this hand, it is not that this muscle is silent. It is happening, there is a concentric contraction happening in the adavadhu kai move agadu, but still the muscle inside works. There will be a concentric contraction happening. So idu constant nadakkuradanalayum the joint will get compressed. So that is another reason why this happens. And majorly இன்னொரு என்ன பிரச்சனைனா, நம்ம கால் விட எந்த பார்ட் ஆஃப் யுவர் பாடிஸை விட நம்ம கை தான் ஜாஸ்தி அசைக்கிறோம். ஏன் நம்ம இப்போ பேசும்போது கூட பாருங்கள் கை சும்மா இருக்குதா பாருங்கள். ஸோ எவ்ரிபடி ஆர் அண்டர்கோயிங் திஸ் தட் எவ்ரி டைம். அண்ட் ஆல்சோ த லிமிட்டேஷன் நம்ம இந்த ரேஞ்சில் தான் பிட்வீன் 60 to 100 to 120 டிகிரிஸாக நம்ம மூவ் பண்ணுவோம். 180 டிகிரிஸ் வரைக்கும் என்றைக்குமே நம்ம எடுத்துகிட்டு போக மாட்டோம். இது ஜாஸ்தியாக இருக்கிறனால, அண்ட் தட் இஸ் ஓன்லி 10% தான் மெயின்லி யூ கெட் தட் ப்ராப்ளம். ஸோ see to it that at least certain part of the day you take your hands to that extent. Adu onnu paathukalam. And also these simple procedures, 5 simple steps. The first step is most important, calm your mind. Emotions are directly related to every part of your body, so calm your mind completely, like as if you are relaxing and sleeping off itself. Andha madri oru calmness varanum. Engiyume alutha irukka kodadhu. There shouldn't be pressure in any part of your body, so muscles completely relaxed. Now step number 2, Keep your palms facing upwards and take your hands up, both your hands together, breathing in, taking your hands up. Then breathing out, bring your hands down. Repeat this for 5 times. Take your hands up, breathing in and bring your hands down, breathing out. This is step number 2. Do it 5 times. Step number 3 is keep your elbows in 90-degree angle and 60-degree arms away from your body. 60-degree arm away from your body. So rotation. This is for the internal and outer rotation for your shoulders. So both your hands together you need to do. Breathe in, take your hands out. Breathe out, put it back on your stomach. Breathe in, take your hands out. Breathe out, bring it back. So as I said, your lungs are directly related to your hands, muscles and the joints. So only breathing is important. Whenever you're opening out your hand, it is simple. Opening out your hand, you need to breathe in, breathe out. Breathe in, breathe out. This has to be done 5 times. Next, the 4th procedure is join your hands, because even if you have pain in your right hand, the left hand will be of aid. If the pain is in the left hand, the right hand will be of aid. Adanala, you join your hands together, breathe in, take your hands up. This procedure might be a bit painful. Yena ungalku limitation eppame oru 60 degrees illana or 80 degrees தான் இருக்கும், taking it above. But this will help you also because gravity assisted your hands will go down. நீங்க எப்படியும் you need to follow this procedure. அப்பதான் the pain will get relieved. So rather do it. Okay, only for the first 2 days வலி இருக்கும், அதுக்கு அப்புறமா pain போய்டும். Breathe in, take your hands up. Breathe out, bring your hands down. You will surely find great difference when you do it relaxed. உங்களுக்கு pain ரொம்பவே கம்மியா தெரியும். Only when you do you will understand. So breathe out, bring your hands down. Next, finally the 5th procedure, you need to turn to your side and make sure you put a pillow behind you, behind your back. And ஒரு துப்பட்டா இங்க டை பண்ணிக்கோங்க just above your elbow joint. துப்பட்டா இப்படி டை பண்ணிட்டு hold this dupatta with your other hand and keep your elbow 90-degree angle. Slightly drop your elbow at the back so that you get the back movement of your joint also. கை வந்து பின்னாடி போறதுக்கும் ஃபெசிலிட்டி. ஏன்னா நிறைய பேர் ஹூக் போட வர மாட்டேங்குது, முடி அப்புறம் பிளாக்ஸ் போட வர மாட்டேங்குதுன்னு சொல்லுவாங்க. ஸோ திஸ் லிமிட்டை வந்துட்டு நம்ம ரிலீஸ் பண்ணிடுவோம். There will be extra range happening here. So then pull. Because it will be painful for some people who it's painful, you have to pull. Then again drop. Due to gravity it will go back. Make sure you put a pillow. ஏன்னா அதுக்கும் மேலே வரக்கூடாது. Normally your range is this much. So make sure you put a pillow and make it drop and pull it back. Do this procedure 5 times. When you're making it drop, breathe in. When you're pulling, breathe out. When you're making it drop, breathe in. When you're pulling, breathe out. That's it. Just follow this 5 simple procedures because it will help you relieve the pain naturally and also in a smooth manner all by yourselves. Okay, meet up in the next video. Until then, take care.